Hi, my name is Jennifer Hart. I am the nurse manager for NICU East. I just wanted to thank all staff for working so hard during this high volume time to keep our patients safe. Thank you.
Hi, I'm Holly Sabatino. I'm the nurse manager of NICU West 2. I just want to give some shout out thank yous to our charge nurses, our PIC nurses, our SDU nurses, and our preceptors for the tremendous job they've been doing during our high volume and high acuity time. Thank you so much.
As a charge nurse, high volume was handled a lot differently this year than it was last year. This year we initiated more situational awareness, and our managers really encouraged the charge nurses to attend bed meeting, which helped us figure out hospital flow for the day. We were able to identify our watchers, what safety things happened overnight. We've also done discharge huddles in the afternoon, which predicts early discharges for the next day. We've seen a slight increase of faster discharges.
From a leadership nurse perspective, I think the new bed meeting script was great because we were able to know what the other units looked like and kind of be able to project what the day was going to look like from a more situational perspective. And I really liked how the FLOC and the NOL and all the acronyms came around and came to round independently on the units and kind of gave like the overview. It just gave more like what's the word I'm looking for? A personalized feel as more of like an institutionalized feel, and it really felt like they were interested in what the unit felt like and how it felt, and it just felt like you weren't alone if there was a situation that was occurring or there was a disgruntled family member on the floor because of a rooming situation. Like, you had extra support on the floor and the whole house knew about it. You just didn't have to manage it on your own.
As a new nurse who started in high flow last year, it almost felt like we were drowning. It was every single day, the entire floor was full. This year was a complete turnaround. Like Ashley said, the support that we received as an institution, I think, really helped us out. We were better staffed. The situational awareness that was being presented at bed meeting helped a lot too. It helped us get on top of things at a sooner point in time than trying to play catch up during this season.
Yeah, absolutely.
Thank you.
Hi, so I'm Alex Nelson, the nurse manager of 9th South. I think this winter felt incredibly different than last winter, and I think there were a lot of things organizationally. I think when I attended the bed meeting, it was really interesting to hear how everyone was communicating, and I felt like it was a lot more collegial and sharing. I think the nurse manager group worked really well, and we really focused how we could help each other throughout this winter. I was really impressed on 9th South. I felt like this year during high volume, we were able to continue with projects we were working on, and whereas last year there was a gap, this year everyone stayed dedicated to helping each other, and they really worked together to keep our harm metrics and have some of the best outcomes we've seen in a while. So really grateful for all the changes that happened over last year.
This year's high volume felt much better than the previous years for a couple of reasons. One being we were very well staffed, so as a leadership nurse, I could spend more time resourcing and educating and providing for the staff rather than searching for staff to be working from shift to shift. We were also more prepared with our situational awareness and being informed in what was going on other units to help us improve the flow from different units with the awareness of what situations occurred and what would be the best time for transferring and accepting patients from unit to unit. Thank you.
Hi, I'm Margie Calazzo, nurse manager for the Special Delivery Unit, and I just wanted to take a moment and thank the entire team for all of your hard work and dedication and for the exceptional patient care you've provided to our patients and families. Thank you.
Just want to take a moment to say thank you to all of the staff throughout the department for your commitment to providing safe patient care amidst incredibly high volumes this year.
My name is Beth Bradley, and I am the NICSI nurse manager. I'd like to recognize and thank NICSI for the amazing teamwork and attention to harm prevention initiatives during this time of high census and very high patient acuity. Although much of the structure of the unit has been affected, your commitment to exceptional patient care has remained unchanged.
Kathy Abel. I'd like to take this opportunity to thank the NICU West 1 nursing staff for doing such a fantastic job during high census, high volume. Your commitment to caring for our patients through high acuity as well as our families has really been commendable this past season.
I'd like to recognize and thank NICSI for their amazing teamwork and attention to detail and harm prevention initiatives during this time of high census and very high patient acuity. Although much of the structure of the unit has been affected, your commitment to exceptional patient care remains unchanged.
I'd like to take this opportunity to thank the nursing staff of the NICU West 1 unit for doing such a fantastic job during high census and high acuity this past season. Your attention to detail to your patients and families has really been extraordinary.
Hi, Denise Donahue. I am the Senior Director of Nursing for the Neonatal Intensive Care and the SDU at CHOP. I really want to thank the staffs of both units. I'm going to start with the NICU. That in January, when high census really started in the hospital, we were right in the midst of our restructure, which has been a huge change for the units. We're restructured into 5 units. I am so proud of the staff for their flexibility. This has been an incredibly dynamic time and stressful. The amount of attention that's been paid to patient safety and harm prevention in the midst of all this restructuring and high census has just been extraordinary. I thank you all for your commitment and really look forward to this continued dynamic process in all 5 of these units. I'd like to thank the nursing staff of the Special Delivery Unit for your incredible commitment and flexibility. Since January, there have been almost 130 births in the unit. It required a lot of time and attention and again a lot of flexibility on your part. I am so grateful during this high census time to have this amazing staff. You rock.
Hi Osmo, I want to take the time to thank everybody for all of the hard work during this year's high volume season. So for the folks who that meant increased surveillance and activities for teams like infection prevention, antimicrobial stewardship, and occupational health, and for other teams where it's meant increased support, so from teams like emergency preparedness, performance improvement, and regulatory and accreditation. I'd also like to highlight the great work that we've done in partnership with our clinicians, so on work like harm prevention, situational awareness via safety and clin ops work, and of course capacity management. So thank you to everybody for all that you've done in your hard work. Thank you for being optimistic, safe, and situationally aware, mindful, and for really taking ownership of the hard work that you do each and every day. For being optimistic, safe, and situationally aware, mindful, and for taking ownership each and every day.
Just do it again.
Okay. Thank you, Osmo, for being optimistic, safe, and situationally aware, mindful, and for taking ownership each and every day. Thank you, Osmo.
I want to take a minute and thank everyone for all your hard work and efforts during this time of high census. This year felt so much different as we had enough staff and really could focus on patients and families and providing them with everything they need, even when we were busy. I think your hard work, your passion, your wanting to work together in different teams has really made a huge difference, and it could be felt throughout the institutions. Thank you for everything you've done.
Hello, I'm Cheryl Hecht. I'm the nurse manager in the Pediatric Intensive Care Unit.
And I'm Jennifer Linzo, the Critical Care Operations Manager.
We'd like to take this opportunity to thank our PICU teams, especially our nursing teams, for all of your hard work over the last couple months when it comes to taking good care of our patients during high census, high acuity, and particularly during this time period where we have sustained volumes and have not had a lot of drops in census. You have been wonderful at keeping our patients safe. We have committed ourselves to our advanced CLABSI education as well as advanced PIV rounding, and we have made a difference for our patients in harm prevention.
We can't thank you enough each and every day for everything that you do for all of our patients, our families, and for each other. Thank you.
Thank you.
It's wonderful to be at CHOP and at a place where we offer services that people from not just the city of Philadelphia and the country, but all over the world come to us, and we are able to deliver wonderful care to them. It can also get a little overwhelming, especially during these very busy winter seasons, and things get very busy both in inpatient units where many admissions come at the same time, and in outpatient clinics where a waiting room can be full of sick children in the midst of winter. In those circumstances, I think we as an organization have made tremendous progress in developing systems and practices and roles that create the ability to bring the right resources to the bedside when it's needed. And most importantly, it's the people who deliver the care on an everyday to the kids that come to us for care that really make this work. And I'm very grateful and proud to be working with all of you as we work through these very busy seasons and continue to deliver outstanding and safe care to our patients. Thank you all as we wrap up this very busy winter season for your collaboration and enthusiasm as we continue to deliver outstanding care to the patients that come to us.